Good morning.
Howdy. Lots of opportunities to leave the meeting. I mean, they're all over the place.
Caitlin, it looks like you were just talking, but I can't hear you. I just want to see if it's my audio. Were you talking? It might be me.
This is Tasha. I can't hear you either.
I can hear.
Lauren, you can hear Kayla or Caitlin? Sorry.
Caitlin, yes.
You can't? I
Yes.
can't hear Caitlin.
Can't hear her either.
Me neither.
Wow. I'm so special. That means I have to do everything.
Right. Any luck now?
Yes.
Yeah. All right. Man, I added my headphones at one point, and now it's like I have to go through like 40 different settings to get anything done. So
Oh, man.
sorry about that, everybody. Good morning.
Good morning.
Good morning.
I was in the invite from the calendar and there was one person in there along with Shane. And I can't go back to tell him yet unless I leave this meeting. So I'll be right back.
Yeah, not a problem. I think Shane's moving people over. I'm not 100% sure what's happening. The calendar invite has been updated with this Zoom link, so I'm not sure how people still have the old Zoom link. But Shane and I have made an appointment together to kind of start sorting through some of that to see exactly what's going on there. So he's gonna be helping me move people over, but I appreciate you calling that out, Joy.
Okay, got it. I saw
Caitlin-
Dennis over there and he's here now. So I think
Perfect.
that's the only other person I saw.
Caitlin, we had this issue with another meeting a while back, and I think sometimes people have the old invite, it's sunk to their calendar, and there's nothing we can do to get it off on
Okay.
our end. And so I think that sometimes that's Like I noticed on my calendar, I still have both, but it's up to me to remove the old one. I don't think there's anything on our end we can do other than maybe we can just spend some time talking today and reminding people to make sure that they remove any old invites off their calendar so there's no confusion.
Yeah.
I think it's an issue we were trying to work with both Zoom and Google on to try to resolve, but one of those technology things we're not up to speed yet on.
No, technology is great when it works.
Right.
Right. I go ahead and share my screen. Go ahead and get the day started here. Then we will be sending it over. Can everybody see that okay right now?
Yes.
Thumbs up. Great. All right.
Yes.
Yep.
All right, good
And with that, we're
morning.
gonna hand it over.
Thank you. Good morning, everyone. We're calling our February BHPAC meeting to order. Thank you for being here. I'll jump right into our roll call. We've got Aaron Black. I can't see everyone's faces, but so if you wouldn't mind coming off mute and just let me know you're here. I think Aaron is here. Natalie Brown.
Morning. I'm here.
Good morning. Thank you. Savannah Brown. Charles Davis.
Here.
Thank you. Carrie Eckert.
Typed in chat present.
Jacob Fry.
Here. Good morning, everybody.
Sean Gartrell. Kelly George.
Present.
Lorraine Gilroy.
Present.
Marjorie Grimsley.
Here.
Morning. Jenny Guencheva.
I'm here.
Morning.
Good morning.
Danielle House. Stephanie Johnson.
Present.
Megan Lovelace.
Present.
Candace Ludwig. Amy Lyden. Dr. Asia Lyons.
Here.
Sharon Mock.
Good morning. I'm here.
Michael Miller.
Morning, everybody.
Dr. Camille Sinclair. Dennis Streeter.
I'm here.
Morning. Angie Wold.
Here.
And Annette Zacharias.
Here.
Good morning. Let our BHA team introduce themselves.
Thank you, Hope. I can jump in. Megan Shelton, Director of Strategy Planning and Engagement at BHA. I go by she, her, and I sit on the seat, the BHA seat for BPAC.
Hi, everybody. Aaliyah Andrews, Recovery Services Manager. I am your recovery TA.
Good morning, Calandra Lindstadt, pronouns she, her, or they, them. I am the Regional Engagement Specialist for the Northeastern region of the state.
I'll hop in super fast. I'm Andrea Jones. I'm our Deputy Policy Director over at BHA.
I'm Brittany Noble. I use she, her, they, them pronouns, and I am the Regional Community Engagement Specialist for Region B, which is the Denver metro area and some surrounding counties as well.
I'm Rachel Simpson. I'm the Regional Engagement Specialist for the BHA for the Western Slope.
Hi, everybody. Good morning. I'm Mariette Nielsen, and I'm the Regional Community Engagement Specialist for the Southeast.
Good morning, everyone. My name is Judith Tieku, and I'm the Community Engagement Manager, so I'm the Regional Engagement Manager for BHA. I see Mark. I'll hand it over to Mark.
Thank you. Good morning, everybody. Mark Hanajani. I use he, him pronouns. I am the Division Director for the Adult Behavioral Health Continuum Division here at BHA. And I think I saw Aaliyah. I can hand it to her.
I already introduced myself,
Oh,
Mark.
gosh, I'm sorry. All right, help me out. Is there anyone I missed?
Let's see here. I don't think so. I think everybody else is fine. So my name is Caitlin Long. I am the Boards and Commissions coordinator, and so I help run all of the meetings for all of our advisory councils, including BPAC.
Can we get our other state partners that are here as well? You were gonna.
I was just gonna thank you.
I knew you'd be on it. I'm sorry.
No, that's okay. Please welcome all of our other state partners and introduce yourselves.
Hi, I'll go first. Rachel Hoare, Division of Vocational Rehab.
And I'm Bonnie Holiday from the Colorado Department of Public Health and Environment, and I'm your Prevention Technical Assistance Provider.
Good morning. I'm Christy Elliott, and Phyllis Reed and I share duties, and she couldn't attend this morning. So I am here from the Department of Education, and we are on the Health Education Services team. So thank you for having me here today.
Good morning. My name is Chris Labana-Frostovsky. I am the Deputy Director for the Colorado Division of Criminal Justice.
Right.
So Caitlin, this is Ann. This is Ann Denton, and I'm your TA provider for Planning Council.
We're very happy to see you, Anne.
Yeah, me too.
Absolutely. Thank you all for being here today. Oh gosh, what a week. What a start to our year. And just grateful for us to come together as we are leaders in our community and wanting to have this space together. This is our safe space. This is a place for us to come together and unite, and just really happy that we get to be here and share our time together this morning. Next order of business is to approve our January 2nd meeting minutes that Caitlin has shared out with everyone. I'm assuming everyone's had a chance to review these. Wondering if anybody sees any corrections or has any feedback on our minutes.
I don't remember getting the minutes, so I'm gonna abstain.
Was that Laureen?
Laureen, yeah.
Yes. Just to let you know, they are always going to be hyperlinked here. So everything that you see in blue, you'll be able to click on and it will take you to that link there. But they are right here, and I've also dropped them in the meeting chat.
I didn't get the agenda either. But you know, I might have missed it, but I looked for it and I didn't see it. My feelings aren't hurt. I'm okay.
Lorraine, I'll double check. I'll send you an email in just a second because it shows me that you did receive at least the email that I have on file for you, but I'll re-forward it to you, and then if you don't get it, let me know, and then we'll meet after this meeting just to make sure that we have the correct email information for you, so you do keep receiving.
Okay, I understand that, and that sounds like a good solution, but when I'm in the meeting and I've got the screen and I try to go somewhere else, I get dropped from the meeting. And can we just chat after the meeting? Can we try it after the meeting?
Absolutely.
Okay.
My mute button got stuck there. Did anyone else have a chance to review the minutes and have any feedback?
I didn't see, this is Annette. I didn't see anything that needed to be changed. It is how I remembered it. So I move to accept the minutes.
Motion to accept the minutes.
This is Charlie. I'll second.
Thank you. We've approved our January 2nd meeting minutes. And Caitlin, I will turn it over to you for the recap section of our community engagement presentations tonight. I wasn't there last month.
Thanks for that, Hope. So similar to exactly what we did at the meeting in January, we wanted to start taking a little bit of time at the beginning of each meeting just to have some discussion about the previous meeting, about the previous presentations, you know, what you all thought about that, if it answered some questions that you might have had, if it made you have more questions and what those are. Really just kind of a debrief and discussion about, you know, what we talked about at the last meeting and how we kind of keep moving forward with that. So the floor is open to you all. The copy of the slide deck is in the agenda. I'm just gonna go ahead and link it again and send it to you in the chat here so you can review it. But yeah, we just want to hear some feedback from you about how you think this presentation went, what additional questions that you might have, and some things like that. So the floor is open, and I'm just going to be taking some notes from you all.
I can start. Hi guys, Megan Lovelace. I had a question around like where we find your updates, right? Like, do you guys do like monthly updates? Are they on like the community engagement website? Or where do we find out about the great work that you're doing on an ongoing basis? So sort of the next stage after the slide deck and we learn about like kind of what you're pushing in on, how do we get the most recent updates about your engagement across the state?
I can answer that. And then Megan, please chip in. That's a great question, Megan. Thank you for asking. We have a few kind of tools in the works right now. We do have kind of an engagement dashboard that we are creating on the BHA landing page. It's not quite finished yet, and so it's not ready kind of, for prime time. So that's a space that we will have, a lot of information and data on our engagement efforts and events across the state, both the ones that we initiate, so within the engagement team, and also others that we support, either other divisions or the commissioner as well. The other piece too is that we are putting together, BHA is putting together a public facing newsletter, and that's one space that we will also be updating you all on some of the work we're doing. Directly with you all, we do plan to provide frequent updates to, at this meeting. So we can either send them in notes to Caitlin, or we plan to be on your calendar maybe a few times a year to provide comprehensive updates on what we have going on. Megan, is there any other piece that we could add?
That was great, Judith. Thank you. The only other piece I would add is we will also share with you all during these meetings, and the BHA calendar will be updated with continued community conversations. So as you all are aware, last year, 2024 in the fall, we were out and in communities all throughout Colorado with Commissioner Smith, doing listening sessions, really conversational style, hearing from community. And then we have spent time taking that input and figuring out what steps we need to take to start to address the concerns that were presented. Some of it we are already doing, others will be in the future, and wanting to get back out to all of those communities we were in 2024. So for 2025, we're currently in the process of getting those scheduled. Once that schedule is available, I will share it out with all of you. And so that will include all of the places that we visited in 2024 with Commissioner Smith, as well as some new sites as well, and some BOSO community engagement. So there's a lot happening for 2025. Most of it will begin in June. And so, but getting it on the books now so that you all will be aware when that is and can share it with your networks and help us get the word out.
I wanted to add one more thing, Megan. So for the regional engagement specialists, we really want you all to really, their goal is to really collaborate with all of you within the regions that they cover. And so please feel free to reach out to them. And I know they will also be reaching out to you on a consistent basis to stay plugged in to what's happening within their regions that, where you live or have interest in. And so that will also be an ongoing connection that you will have with the team as well.
Thank you. And to that point, that was my question around will the calendar show what each community engagement specialist is focusing on, right? As the BHA as a whole, right, you guys have that stuff on the calendar for engagement. And I think for each of us in the council, we all have our own networks, right? And it would be really great if we could share Brittany's doing this thing or Rachel's doing this thing, or that we could share those more specific engagement opportunities. As we know, there's a lot of people reaching out to all of us right now saying, what can I do? How can I get involved? And we'd love to really be able to say to them, go to this, space on the website and check out, this is your engagement specialist and here's all the cool stuff they have going on, or some sort of more forward facing way other than just saying, hey, email Brittany, right? So that they're not just well, I don't know, what am I supposed to say to Brittany, right? That there's a thing that they know they can go to. So it feels like there's no barrier to entry when they want to just get involved, but they don't quite know how. And maybe they don't have a specific thing they want to bring to Brittany, but they know they want to meet her because she's their engagement. But like that kind of stuff, I think would be really useful for us to then populate that work out. So not only does everyone know who their community engagement specialist is, they also know that there's opportunities to get involved in their community.
That's a really great point. And, we have been noodling around a few ideas. We wanted to create kind of a regional specific newsletter. We also are very mindful about flooding folks' inboxes with newsletters and knowing that there are numerous of those out there. And so we are still kind of discussing what the best vehicle would be to share that, and would love to connect with you, Megan and Anna, would love to connect with you offline to really, kind of brainstorm on what you would recommend to be the best strategies or the best tool really to use to communicate without feeling like we're going to inundate folks' inboxes. Also knowing that newsletters aren't necessarily the best ways. People don't often open them. And so we would love to discuss this further. Any other thoughts from my team? Anything else to add?
Judith, hi, this is Calandra. Oh, and Marjorie, I see you have your hand up. Do you mind if I respond to Judith real quick first? Okay, perfect. Judith, I was thinking that it would be great to collect the email addresses of the folks from BPAC who are in each of our regions and know regionally where they are. I have a list of all of the email addresses, but I don't know regionally where everyone is, and apologies, this is on me. But if we could get the regions where everyone is, then I would be more than happy to send out, you know, just a BPAC specific, even regional update, you know, where I plan to be out in the community over the next month or whatever. And I would love for BPAC to join me. So maybe if we had that information, because I do think targeted newsletters to people who really want the information and the updates do get opened, and y'all are the exact right group for that. Let me know if that hits you, if you like it or not.
Megan, how do you feel about that? I don't want us to take too much space. I know you have a full agenda, but I would love for us to discuss this further, you know,
Let's
kind of
keep
offline.
discussing it. And
Okay.
yeah, you know, social media channels too. You know, I'm an old, so I don't do the social medias, but lots of people do. And it's probably a great way to reach people with just little blurbs like Calandra will be, you know, at Extension in Fort Logan on blah, 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 or whatever it is. Like, come meet us. We're going to talk about farmer and rancher mental health, right? You know, whatever it is, it would be great just to kind of like create a sense of awareness in that space. So it's a message from the BHA to the community that like there is someone in your neighborhood who's so willing to sit down and chat with you or get involved in the great work you're doing. Marjorie,
Thank you. This is really helpful.
Your hand is.
I just wanted to add that I know with other programs, specifically with collaborative management program, they do a monthly newsletter, and I know Sharon's on here, Kari Eckert. We are, you know, people are part of local governing groups through the collaborative management program, and their newsletter might be another place to share information. But I'm sure there's other newsletters that go out that by inserting some kind of article or just an information about who you are and what you do, that might be a way to reach people that you might not otherwise.
Thank you, Marjorie.
Any other input or discussion around the community engagement presentation or what's happening within community engagement? Okay. Well, thank you for that. We'll move right along then. We do have a lot to cover today. We'll move into our BPAC business. Very grateful. I want to thank everyone for your support and involvement on our BPAC bylaws. This was a team effort. A lot of time and energy went into creating them. They are available. They are signed. They are official. Thank you, Caitlin, for all your support and work on this and for showing us where we can find our lovely BPAC bylaws on the BHA website under the document and forms. So easy to access, and we are official. So thank you. We've got our bylaws. This is wonderful and really grateful for everybody's input and effort and time. Moving right along and are becoming our official, wonderful council that we are. So thank you everyone for that. I am going to turn it over to Caitlin to speak to our commissioner updates, please.
So just wanted to let you all know that I am starting to work with I forget her exact title, so my apologies, but basically the assistant to the commissioner, Johanna Baca. She is absolutely wonderful. She began a couple of months ago now, and so I'm going to be working with her to create either monthly or bi-monthly updates from the commissioner. We're doing this for one of our other councils. We thought that we would just share it across all of our councils. So it kind of helps you keep in the know of what's going on It will provide, some high executive updates on what's going on with the BHA, what's going on with the state in general, and, upcoming action items, goals, things that we've achieved previously, and things like that. So just wanted to let you know that I'm working with Yo to get those created. Hopefully the first one's going to be coming up in March. So we'll just keep you updated on that. And I'll be sending them to you via email. So again, just kind of keep an eye out for your email when those come through, and then let me know if you have any questions about those moving forward. I'll turn it back over to you all.
Thanks, Caitlin. Next line of business, we've got our BPAC meeting information packet. So for anybody that is going to sign up as a guest to join our monthly meetings, my understanding is within the sign up page, this gets, when folks sign up, this packet ends up in their email. So everyone has a chance to review our information about attending our meetings, information on ASL interpretation, closed captions, our group agreements. So it's laid out very clear, our code of conduct, that we require individuals to be respectful in our meetings, stay on following our agenda, what the purpose of our meeting is, engagement, professionalism. And so this is another new official business that we have available for any individual who will be signing up to join our meetings. We'll have an opportunity to review this information and understand how we run our meetings. And so this is also new. And thank you so much, Caitlin, for your support and work to make this happen for us. I know we're moving pretty quickly. If there's any questions on anything we're sharing, please just raise your hand and let us know. The next, we're turning over to Megan Shelton for a CCBHC update.
Thank you, Hope. And Tom Miller was joining this call for this part of the update. Let me see if he is on here. Give me just a minute.
While we're waiting, I did go ahead and just drop that website into the chat so that you guys can follow along with some of the work already happening in that space.
Thank you, Megan.
And I'm also sending Caitlin a notice from HICPUF that is an invite to join the steering committee for the CCBHC that Caitlin can share in the notes, because my technology skills are not great enough for me to drop this information in the chat. But we'll make sure you have it, and invite your friends or people you think would be great for the steering committee when you learn more about the CCBHC. But if your burning question is, what's the difference between CCBHC and CBHC? CBHC is an organization. CCBHC is a federal program, if that helps with the delineation, because the acronyms are so close and it is easy to get confused.
Okay, you all, it looks like he hasn't responded to me yet, so I'm sure he's in something else. And that may be on me for forgetting to add him to the invite. He was planning to talk about it, but I think this would be a good topic to pivot to our March meeting, if it is okay with you all. We had, as Megan knows, we had a discussion in another meeting about this, and it's a pretty lengthy discussion. I think it can get pretty detailed. Definitely want some feedback from all of you. So if we want to pivot this portion to the March meeting when we can have some more information to be able to share with you all, I will pass it to you to make a decision on that, Hope.
Can you, excuse me, tell me what CCBHC is? Because I don't know either one of them.
So it is federal, and I can get some more information for you, Laureen. I started learning about it yesterday, and I don't want to give you any misinformation.
Can you just tell me what the acronym stands for?
Yes, let me pull it up for you.
I can help out if you want.
Mark, that would be great since you're on here.
Sure. It stands for a Certified Community Behavioral Health Clinic. And it is something that SAMHSA, a designation that SAMHSA would give to agencies. And, Colorado has through as a state, but healthcare policy and financing, we're certainly partnering with them, have received and been awarded a planning grant. And so we're working with our comprehensive safety net providers in Colorado to take a look at this model and plan for how we might look at implementing this in Colorado. So I'll put in the chat the SAMHSA link so that everyone can kind of see that. And you can kind of read up on your own. And then the other one, CBHC, is the Colorado Behavioral Healthcare Council, and that is the trade association in Colorado for the artists formerly known as community mental health centers, now licensed as comprehensive safety net providers.
Thanks, Mark.
And also,
Thank you, Mark.
Lori, there are monthly meetings that you can attend that HCPUF is putting on in conjunction with the Behavioral Health Administration to just kind of keep everyone updated. The first one already happened, but they're every month, and it's on the website. So you can go, and I actually just put the registration link in the chat as well. But you can register for these monthly meetings to get the updates, to learn more about how this is being rolled out. I would never speak for Tom Miller, and I'm not a lawyer. I just play one on TV. But what I will say is this is like a planning grant. I think that's right, Mark. So this is like how we're going to figure out how we're going to do the it. And much like a federally qualified health care center, this will allow our state to bring down more federal dollars for behavioral health. I hope I got all of that right, Mark. And so this is sort of like we're all doing this together right now. So you can sign up for those monthly meetings to stay in the loop and see how you can stay involved in the work.
Thank you for the teamwork here to try to bring some understanding. And if we don't have what we need for our presentation today, then most certainly we can move that to next month. Not to put you on the spot, and I wonder if there's any other kind of high level input from your end to just kind of give any more information on a CCBHC for us.
I don't have any input on that, but I was, one of the things that I'm hoping to achieve by being here today is to figure out how I can support the implementation of your bylaws and specifically the committee structures. And so as committee meetings get scheduled, if you'll include me, that would be great. And Caitlin, is there anything else that I'm forgetting to bring up in terms of the bylaws implementation?
I think so. Just kind of wanted to, while we have you in, and I'm going to refer back to Megan and hope on some of this as well. Just, address the elephant in the room about the uncertainty of everything happening, and how, we might not know everything yet. We're going to continue as normal, and, we're going to support each other through absolutely everything. And so definitely, wanting to talk through some of this, since we do have you here right now, which is just, I'm so happy to see you.
Yeah, me too.
Megan's involvement in the federal level and everything, just to, address the elephant in the room and let everybody know that, we might not know, but we're going to continue on and forward. And we're all in this together. We're going to keep supporting each other as we have
Right.
moved forward. So going to pass it back over to you all.
Yes, we're not sure. We weren't sure for a few days there whether or not this technical assistance would continue or not. But at this point, we're good to go for right now, and we'll just take it as it comes.
And just to add to that, there's a lot of sort of technical things happening behind the scenes. And I think what we want you all to know is that we are a united front where we come from a space of love. SAMHSA is here to help, right? And everybody sees that piece. So as we look towards the uncertainty, let's remember that SAMHSA is a space of hope. And in my federal work, most recently speaking with Health and Human Services, we talked about that, about how SAMHSA is sort of this beacon of light in Health and Human Services, and how everyone can agree about that one piece, while we might not see agreement across the board. And when we look at budgets, there's a thing called a continuing resolution, and it looks like there may be another one. And what that would do is to just to keep funding as it is, right? And SAMHSA's already written into the budget. This isn't sort of this thing that magically happens in one moment. So if there is a continuing resolution, that you'll hear that called a CR, that would mean that current funds would stay in place. Andrea, please step over me if I'm saying something wrong here, or Anne. But this is what I'm hearing most recently in regards to the funding levels. But Anne, please tell me if you're hearing something different.
I'm not hearing anything at all. So that you gave me more information than I had. Thank you.
I was actually about to second that, Megan. So thank you. This is just so rapidly evolving. I just don't know that we can expect any clarity and guidance over the next couple of weeks. So we're just managing through it, as Caitlin said, sort of some certain as we were until and unless we're notified that anything has to change at this point. There's so much litigation, there's so much talk. I just don't see anything moving quickly, but.
And markups aren't till March 10th, right? So a markup is when they write the numbers in the budget. And they may propose what they call an FY 25, which would be fiscal year, and that would be like a bigger budget package. But they also have right now what's called the continuing resolution. So we can keep an eye on that, but until we see those markups on the 10th, which would be for either the FY or the CR, sorry about all the acronyms, that's when we'll have a better sense, because we'll be able to actually look at line items. However, this is a space for love, not panic, right? You guys, we're all in this together. We're all going to the same place, and our intentions are all to serve the people of Colorado. So the more we stay focused in that space, that we're all working towards the same goals, how grateful we are to have Anne here with us, doing that work with us, the federal work, the state work, our local work. It's all intertwined in this space where we keep showing up every single day to let people know we're here and we're not going away, and we're here to serve you with compassion and dignity.
That was very well said, Megan. And Bonnie agreed. Just space for love, not panic. That was great. Thank you.
Thank you. That was so eloquently said, Megan. And I think that this, like you said, this is our space, and living in and managing, like, I don't know, I keep coming back to locus of control, like what is within my sphere, our community sphere, our state sphere, not fear. That's what's in our sphere and what is within our space, and acknowledging that. But as you mentioned, just as united we stand, right? And we to block out as best as we can the fear that I think that is trying to be created, and we know what that does. And so I just really appreciate the love and the space and the community that we have here and the support that we have of each other and trying to navigate uncertainty. And as was shared, I mean, we are in this together, and it is just an uncertainty space. I want to thank the commissioner put out shared that her email on kind of what's happening as best as we can. I was really grateful to hear that. I was really grateful for an email from Aaliyah Andrews. Thank you. And having support from the BHA on what's happening in real time as best as we can. And so I just want to thank everybody for your communication and support. So I didn't know if there was anything around from anything else from the BHA's end around that to share. We've still got some time before we're taking our break.
Hope, I think that really sums up what we can share and what we have to share in that space.
Okay, well, you know what, you guys, we're holding the line, right? Each one of us in our community, with all the work we do every day, is showing people we're showing up. And I think we all have our own support networks in place. And we encourage each of you to tap into the things that bring you joy and to log out when it feels overwhelming. Remember, there are lots of us doing this work, and we're all doing it together. So if you need a day to rest, know that there are so many other people that are doing this work, and it's okay to take an out breath, to take your dog for a walk, to say, I'm going to take a mental health day today. That's okay too, right? We all need to care for ourselves so we can care for each other.
Especially taking the dogs for the walk with this beautiful weather when we have it. Yesterday I had all my windows open, even though it was really windy, and I had all the dust in the house, but you know what? It was worth it.
Well, thank you. And thank you for bringing it back to having this conversation, reminding us of our own wellness. It's important because we can't be in community if we're not taking care of our own selves, whatever that looks like. So thank you. I think we'll go to our break. Seems like a good time. Take a break, stretch your legs, get your coffee, whatever you need to do to take care of yourselves. And we'll be back. We can stay on track at 10 o'clock. So we'll see you then.
Howdy, everyone. 10 o'clock.
Hey, right on
Hello.
time.
So excited to hear about rural and frontier funding and program access. And just wanted to make sure, because we've been talking a lot about rural, that we want to acknowledge to our urban partners on this call, serving our urban corridor, that we most certainly are not leaving any urban considerations behind, simply highlighting our rural and frontier programs, as we know we continuously hear about lack of access, and how exciting to hear more about access. Just a little caveat before we get into the next stage. Hope I didn't overstep there, Hope.
No, I'm grateful for you to highlight that, and it's important to hear and to share. And so without further ado, let's turn it over to Mark to share your presentation with us.
Thanks, Hope. As we get started, I wanted to first kind of do the acknowledgement. I'm going to tell you about some of the ways we are making efforts to expand access, or have made efforts to expand access in rural and frontier communities. But I got to start with, what you already know. Access is more limited in rural and frontier areas. There aren't Costco's. There aren't a lot of different specialty primary healthcare types of services. People have to drive a long distance for lots of different things that other people in our more urban corridors or in suburbia often take for granted as being readily available. So that is not lost on me as I talk about some of the efforts we've made. I realize it's a challenge, and it's one that we have to continue to try to make more strides in. So with that, and I made the horrible presenter mistake of eating a bunch of mixed nuts right before I had to speak. So my bad, and I apologize for it. And I don't have anything to drink, so I'll get through it. So hang with me. Let's go to the next slide. So I want to look at the current state and specifically look at it from the lens of crisis services, some mental health services, highlighting a couple programs, substance use disorder services, and then really looking at recovery support services as one of the areas which I think is some of our bigger success that we've had. But let's jump right in with some of the crisis services, which is on the next slide. And again, in Colorado, we look at the crisis line as kind of the center point, and that is, in Colorado, we have 988. We still have the Colorado crisis line phone number. It's the same vendor that operates it. We have walk-in and crisis stabilization units. We have mobile crisis response, and then we have respite as what we consider part of Colorado crisis services. Let's go to the next slide, and I'll talk a little bit more in detail about some of these. So the 988 Colorado Mental Health Line is really, obviously it's statewide. It's not an in-person service, but it's available 24/7, for anyone in Colorado. One of the challenges when 988 launched, of course, unlike 911, where wherever you call from, whatever, if it's on a cell phone, it will identify you at the closest tower and hook you to the correct public safety answering system, the right 911 call center. So if you have a Colorado number, but you are on vacation in Boston and you call 911, you won't end up talking to Colorado. You will be routed to the 911 thing. 988 was not set up that way to start. However, geo-routing is fixing that. AT&T, which is one of the biggest carriers, particular in rural and frontier areas in Colorado, is one of the last big ones to make that shift, and that will be happening March of this year, so next month. So we're very excited to have that. What that means is right now, if you have a Colorado area code number, you're going to go right to the 988 Colorado mental health line versus an out-of-state line. But if you have an out-of-state area code, as a number of Coloradans do, we have a lot of people from out of state, and so their cell phone is an out-of-state number. Prior to geo-routing being addressed, that was going to route you to wherever your phone number was. So if it was 617, not that I have Boston on my mind, but yeah, it would send you to Boston, to the call center that serves Boston. So that's gonna, that has been fixed for many of the other carriers. AT&T is the last one, the last biggie. And of course, it's the one that serves a lot of rural Colorado areas. So that's going to be improved. But you can see just some of the data of why people are calling, some of the outcomes of calls. You can see, nearly 80% of the calls that come in to 988 Colorado, no additional services are needed. The person's needs were met, and that's its goal, is to try to provide stabilizing support, crisis stabilization work right there on the phone. But they also can be the conduit to other pieces of the system. They can dispatch mobile crisis response if there's imminent life safety with lethal issues going on. They have relationships and can connect to the right 911 center to send emergency services. But again, the first effort is to try to address a behavioral health crisis with behavioral health professionals. So the people on the phone who are trained crisis workers are able to do much of that, but they can also dispatch mobile crisis response, which does not include law enforcement, to go and offer in-person support to every county of Colorado. So that's an important piece to understand, that 988 is your front door. They can also offer referral services, right? In terms of, I'm struggling with this, my family member struggling with this, I don't know where to turn. They can offer some connections and linkage to some community supports based on where the person lives. You can see the caller presenting problems. Obviously, suicide factors is number one. Other wellness concerns, social interpersonal stress, resource or role stress, substance use, safety concerns, disability, violence factors, and then some had no information. So you can see the information about why people are calling. Let's go ahead to the next slide. And before I start talking about walk-in, did anyone have questions? I don't need to just talk at. I'm open to questions. I'll ask for help from my teammates. I'm monitoring anything that comes in the chat. But if you have a question about 988 or anything, feel free to let it rip. I'll give it a 3, 2, 1, and I'll start talking.
Actually.
Bring it. You got it.
Laura, I noticed that you've got your hand up. If you would like to go first, that's fine.
No, you go ahead and I'll follow.
I was just wondering, because I do live in an area of Colorado where phone service is really spotty. Does that data actually take into account when calls drop, or they're not able to continue communicating with the person because of poor data service or anything like that?
So I don't think that slide showed that information, but that's certainly something I can inquire about, is how often are calls or texts interrupted or dropped because of a bad connection. So I'm going to write that note and I'll follow up and see if I got that information, and I can feed it out to the group so that we have awareness. But yeah, we certainly know that that's another challenge of a phone-based service when there's spotty phone coverage.
Excuse me, Mark.
Yep.
Is that it? I caught your nut stuff.
I'm sorry.
I don't know where I heard it, but it would be some kind of a news show that someone was not pleased with the service she got on 988, and it was kind of a negative blip about 988. But I was surprised that the vendor was in Arizona and they made a big deal about that. I would just like to see, as you keep improving, which is a good deal. I like it. And it's hard because, I've got a 918 area code and I don't know where my calls are going to go. Um, if I think she couldn't get to somebody, she kept getting transferred here and there, and I don't like seeing that or hearing about it. And I know it's difficult, but I mean, the 911 folks don't seem to have that problem, but that's because they have a lot of people working. So if you could just pass on, or if you're the one who's working on it, um, that the first person that answers the phone, that's the most important person, I think. And if if you need more help, I think that there could be some folks that would be local. I can't stand calling someplace and they go, well, you take a left at Tucson, and it's like, man, I haven't been to Tucson for 30 years. Where do I go here? I'm not talking to somebody who knows me, knows my place. So I guess I'm just forwarding that on to
Yeah.
deal with it.
I appreciate you sharing and wanting to make sure that we have quality services is important to us. It's important to the vendor Solari. I see in the chat, that they've agreed to meet with anyone who has concerns. And yes,
good.
Thanks for that piece. That as I understand, it wasn't our call center that fielded that. There was a speculation that the dialogue was AI generated, meaning artificial intelligence or whatever. It was not. It was following a script, but I've read that as well, and it didn't look very welcoming, right? So I think they're certainly doing at the larger level, which is SAMHSA's kind of system organizer, Vibrant, that works with all of the different call centers in the nation, to kind of say, let's look at our processes around text and make sure that it feels more welcoming. Text is always more challenging in terms of as compared to a warm voice of a human being. But we know it is the tool that so many people use. We need to make sure it's effective too. So we've heard that story. We're working with both federal and Solari to kind of identify what happened there. How do we improve? How do we make sure that anytime someone reaches out, they get the support they need? And again, the geo routing piece is going to make it at least better so that someone doesn't get routed out of state because of the phone number they call from.
Right. Okay. Thanks very much.
You see that question in the chat, Mark? Yeah.
I do, and I would love it if we can keep this chat so I don't have to write it down. But then I can follow up with our 988 team and see if we have an answer for that one. Okay. Because I don't know the answer.
With the meeting ends.
Okay, good. Thank you, Caitlin. All right. So walk-in crisis. Here are a number of listed facilities. Obviously, most of them are in big populated areas, so it's going to be a bit of a drive for people in a lot of our more rural areas. I will say that there's two facilities that aren't listed here because they're not yet licensed as crisis walk-in clinics, but they're essentially operating that way, and we're working with them to get there. And we know the beautiful new facility that Summit Stone opened up in Fort Collins. We know the facility that is opened in Salida as well, that Solvista opened up, is just doing some wonderful work. So those are kind of additional places that don't show up on this map that are there. But again, this is anyone can come up and just in the moment seek some care for whatever their behavioral health crisis might be. Let's go to the next slide. Go ahead, Megan.
Just quickly, we do experience some disconnect with Sol Vista outside of Chaffee County. So Lake County is not really receiving services, and that's still about an hour drive for any of the Lake County residents. If you can rise that up, that's been a ongoing concern in the small community of Lake County. Thank you so much.
Okay, thanks. So mobile crisis response is one of the, with the recognition that 24-hour care facilities like a crisis walk-in clinic or a withdrawal management facility or anything that's 24-hour, that the staffing costs are huge. You have to have a building. That's a big cost. We have labor challenges in Colorado. And so really mobile crisis response is the strategy to make sure that we can actually bring behavioral health professionals to your door anywhere in the state. So this is a 64 county approach to crisis response. And again, the best route for access is through 988. If 988 is not able to kind of resolve the crisis and offer support, they do have the ability to dispatch mobile crisis response teams. We have a number of teams, all throughout the state that are able to get there. It is not calling 911 where, EMS is going to get there in 15 minutes or 5 minutes or whatever. Obviously, in rural areas, it might be that 15 to 20 minutes, even for emergency medical services or law enforcement. For mobile crisis response, our standard is in our metro counties, it's an hour response. In our rural and frontier counties, within 2 hours, we can get someone to you. Now, again, if you're calling 988 seeking this, in a crisis, and comes to the idea like, you want to request or they suggest mobile crisis response, they don't just hang up and say, great, someone will be there in 2 hours, good luck. Like they can stay on the phone with you until the mobile crisis response team gets there to offer you the support that you need to make sure you're safe. So you could see those time frames. Now, one of the things, last year we made some upgrades to the standards for mobile crisis response. Prior to that, we were a little more flexible because Colorado had kind of created our own system, and they would go to facilities like rural emergency departments. They'd go sometimes to even local jails to offer some support. That's called facility-based response. And it would often be just a team of one, right? So a national standard is a paired response. So 2 people. There's always one trained crisis professional, and then the other member could be a peer support. They're configured lots of different ways. We have models in some places where they are actually paired with EMS, with a paramedic. So again, no law enforcement is a part of mobile crisis response, but there's always 2 people, and it's is no longer facility-based response. Really, we want to reserve this service for a community-based response, meaning it's going to go to your home. Maybe you're in a local McDonald's and having a really rough day, and you call from there. They can meet you at McDonald's. There's lots of options of where they can come meet you. But if you're at a hospital, you're in a safe place. The hospital should be able to have supports to help you in that moment. That's not the role of mobile crisis response. We want them freed up to serve people in community. All right, let's go to the next slide. Thanks. When we get into mental health services, I think one of the, particularly when we're talking about individuals with severe and persistent mental illnesses, one of the evidence-based practices that is well known is assertive community treatment. After the Aurora theater shooting, then Governor Hickenlooper really challenged all state agencies to say, what can we do with some better behavioral health services that would potentially prevent these types of incidents? And really, that was where the formation of Colorado Crisis Services started. But it was one of the other things that came out of that effort was a bill to say, you know what, we've got 3 community mental health centers that are providing ACT right now. This is a proven model that helps people stay out of hospitalization. We want to see, and this was really a request to our old office at the time, Office of Behavioral Health. I helped in writing some of this. Let's see if we can get funding to make sure that ACT is available at least through all of our comprehensive safety net providers, our community mental health centers at the time. And we've continued that. And it is a Medicaid covered service. The reality is about 95% of the patients that that receive the service are covered by Medicaid, but particularly in rural and frontier areas, it's a rich service to offer, meaning it's labor intensive, right? So it's a costly service. It's a team approach. You can see the information on the slide, and the costs if you have a full team of 30 patients being served by the ACT team, the amount of service they deliver, that's a lot of billable hours that they're able to provide. So more urban areas that offer it, it's still an expensive service to provide, but it's almost cost neutral. It doesn't take a lot of additional funding from us to help them sustain and have those ACT teams. But in rural and frontier areas, there may be 7 or 8 patients that are on that ACT team, but you still need to have dedicated nurse and psychiatric time and a case manager and other team players that all cost money. And so basically they would operate at a loss if not for the investment from BHA saying, hey, we're going to supplement this. Even though these are mostly Medicaid clients, this is such an important service for people with serious mental illnesses and a big part of the safety net that we're going to make sure that we use that funding we got from the legislature to fund this program. And as I say, it's offered through all of the safety net providers, the comprehensive safety net providers, or the CMHCs. It doesn't necessarily mean it's statewide, right? There are some providers that offer ACT and they make it available to all the counties where they operate. But there are others that just don't have that reach. Again, it's a pretty expensive service to offer. And you look at whether it's a provider like Mind Springs or some of the others that have huge land masses with low population density. A lot of times this service is only available in their main population centers. So while we say all the providers have it, it doesn't necessarily mean all the citizens have access to it. So we recognize that it is a cap for some corners of the state. Megan.
Thank you. I love that you guys are doing this. Yes, it's expensive. And I wonder if the team is, working to enroll some of these individuals into Medicaid eligible programs outside of MAGI. So buy-in, also the LTSS programs and those variety of home and community-based waivers, also CDAS, right? Because here are ways where when you say these are Medicaid clients, that we can look at expansion programs and other Medicaid available services to lessen the financial burden, as well as make sure that these individuals are in long-term services because of just kind of some of the verbiage you've used in this slide. It looks like these are high acuity populations who most likely do qualify for long-term service supports.
Yes, they are, and excuse me. The providers are pretty well versed at making sure that clients get enrolled in whatever services they're available to them. We know that there are certain Medicaid packages that don't have a behavioral health benefit, but certainly enrolling everyone that comes to the door in Medicaid is a key piece of how we make sure we maximize Colorado's access, right? So essentially any provider that BHA contracts with for a Medicaid covered service, our expectation is that provider is enrolled in Medicaid. They essentially should be able to have a Peak Pro account, so that they're able to check someone's Medicaid eligibility, but then also support that patient in enrollment for Medicaid. So thanks for bringing that up. And that is kind of built into our expectations for our system to really make sure clients who are eligible for any type of Medicaid product are properly enrolled so that we can maximize those resources. So on this slide, I obviously talk about, I go right to a really intensive service for adults with SMI, and it is for high acuity, and people, they don't do a 2-month stint on ACT. It's usually, if you're enrolled on an ACT team, there's not a lot of turnover because that team stays with you. Even as you stabilize and life is going pretty well, you're still connected to the ACT team. The connection points each week may be a little less than if you're going through a more challenging point. But even if you end up having to be psychiatrically hospitalized or go to a CSU or have some sort of crisis, you're not kicked off the ACT team. The ACT team should be able to connect with you while you're in the hospital, support discharge planning. That's an important part of how ACT works. But I did want to talk about a couple other programs in the child space that I don't have a slide for, my mistake, but I think everyone's pretty familiar with the iMatter program. Again, Colorado is a leader in the country of being able to offer free counseling services for young people, up to 6 sessions, low barrier, meaning you don't have to have a formal diagnosis to be able to get access to these counseling services through licensed professionals throughout the state. And we have made a very concerted effort with the iMatter program to do outreach and engage with clinicians in rural and frontier areas. I don't have the map with me, but I will do a follow-up because we have the iMatter report that came out. I'll work with our team member that does that work and see if we can kind of share that out with everyone so you can kind of see the reach of the iMatter program, how many kids have been able to access these free counseling services, and which counties have been impacted, because it's a really exciting thing that we've done, and I'm very grateful that the legislature, it started with money during the pandemic, recognizing the incredible impact the pandemic had on mental health for our young people. I think for all of us, but certainly we know for our young people. And so they created this program, and seeing its utilization and benefit, making it ongoing is a huge win for our state. So that's one. And then the other one is Child Youth Mental Health Treatment Act. And I'll just put the links for both of these in the chat so that you have them if you don't already. So that's iMatter. But the Child Youth Mental Health Treatment Act is another one. And again, this is designed for families with young people. Eligibility is really that you don't have child welfare involvement, and that you're not Medicaid eligible. If you have Medicaid, there's services. Many of the services that Child Youth Mental Health Treatment Act are covered under Medicaid. All of them would be. But this is a recognition that there are people that may be commercially insured or uninsured, whose insurance doesn't offer some of the robust services for high acuity kids that you would have if you were on child welfare. Instead of pushing families to say, I have to open up a child welfare case to be able to access the supports that my family and my child need, here's another opportunity for people to get care. And it includes just a large array of services. There's lots of vendors. We currently work with our ASOs, administrative service organizations, that have managed our crisis services to kind of be the point of contact, to do the care coordination, and to kind of do an initial screening with families, and then do a comprehensive assessment. And based on that assessment, they work with the family to identify what interventions will be useful, and then arrange and coordinate to get people connected to services. So again, I'm sorry I didn't have slides for these. I just realized, I was a little adult heavy on this slide, coming from the adult division here at BHA. And I wanted to recognize that we have done some really strong efforts in the mental health space for kids. So you've got those links, and I can do some follow-ups as well. Yeah, and I see that Megan kind of saying this leaves our low-income families at risk for child welfare involvement. This is what Child Youth Mental Health Treatment Act is intended to try to prevent, is to avoid having to go the child welfare route to get services. Again, if you are eligible for Medicaid, you don't need child welfare involvement to be able to access some of the services that are covered. I know people need to jump soon. There's a couple hands. Let me hit those, and then I'll boogie on with my slide deck.
If we can, because I know we're like halfway through the slide deck right now, if members wouldn't mind just holding questions to the end so we just can get through this. I just want to be respectful of everybody's time. So I'm sorry.
Gotcha. All right, next slide. And go ahead and push.
Okay, thank you.
All right, you can push me along too, feel free. So I wanted to look at in the substance use space, another example of where we made some real efforts when we started our response to the opioid crisis with federal grants that a bill that President Obama signed, it was that long ago, that we worked on this. We recognized that at that time, 30 counties in Colorado did not have access to medications for opioid use disorder. Half of our counties, more than half of our landmass, because there was a lot of big rural counties that didn't have access. So we had a number of different strategies to try to train up some doctors so that they could be approved to do to treat people with buprenorphine, one of the FDA-approved medications to treat opioid use disorder. We still found that we had big gaps. There were some counties that had very few prescribers, and some of those prescribers, while they were more than happy to write a prescription for someone's pain, they were not comfortable writing a prescription to help deal with someone's opiate dependence that may have started with pain medication. So it was very frustrating, but we said, well, you know what? Let's come up with another plan. And so we purchased with federal grant money 6 mobile health units. These are RVs. You got a picture of one there. We've got a number of operators, 3 different providers in the state operating these 6 mobile health units. They've got fancy telecommunication capabilities, so they can video conference in the prescriber to have a video conference conversation with each patient. There's a nurse on board. There's a peer on board. And they usually set up shop, parking in the parking lot of a pharmacy that they've arranged with, so that the pharmacy has the medications on board that they would be prescribing. These facilities, these mobile units do not carry medications with them, but the patient can, the prescription can be given, the patient can bring it or can go pick it up at that pharmacy, and they can take the first one on the clinic with the nurse, and then they can have their prescription. They come to the same place every week, so they can kind of check in with those patients on a weekly basis. They can offer some counseling services. This launched right when the pandemic hit. So we did set up, to do some of the counseling services remotely. Some of it can be offered on the unit. They can certainly do some connections to other community resources as well. They have a lot of other options. They do harm reduction, naloxone distribution, a bunch of other things that they're able to do. But this was a great way of bringing access to MOUD to all those unreached counties. As of this point, I think Mineral may be the only county in the entire state of Colorado without an MOUD access point, and one of these mobile health units drives within 5 minutes of their eastern border. So we really have made great strides to increase access for MOUD in Colorado. Let's go to the next slide. Okay, so you can kind of here's just some data. 2,000 unique rural clients being served. 91% of the visits were for MOUD, but you can see some of the other things: drug test strips, harm reduction, referral and navigation, naloxone, hepatitis C rapid testing, etc. So we've reached at least 42 counties throughout Colorado with these mobile health units. Go to the next slide, please. Okay. Another thing that we have funded, a service that we have funded that is free for families throughout Colorado, is this CRAFT program. And this is a service for families who have a loved one struggling with substance use. It can help reduce harmful substance use within the family. It is far more successful. You may have seen like intervention shows or things like that. This is an evidence-based practice of successfully being able to encourage your loved one to seek support and treatment. So encourage the person struggling with substance use disorder to find and start treatment. And again, it also helps that family member that is struggling themselves to improve their own life through learning positive communication strategies. There are lots of remote options available, but we do have options in many places in Colorado, including Trinidad, Loveland, Sterling, Canyon City, Milliken, Walsenburg. So the website, when the slide deck is shared, gives info of where you can find these groups. Again, plenty of remote options, so anyone in the state can attend if you've got digital capabilities, but lots of in-person things, options as well. They are free. Certainly the in-person ones have also been trained as well on naloxone, the overdose reversal medication for opiate use disorder or opiate overdose. And they also distribute naloxone through these craft groups. Jessica Triplett's a trained trainer. She does train the trainings for facilitators around the state. She works on our SOR team here at BHA. Okay, let's go to the next slide. Does it include couples work? Couples can go, but it isn't a couples therapy. It is kind of a group thing for families. So a lot of times they're offering some food as well. They're often offered in the evening. So families, a couple can go, an individual family member can go. But there's, it's a group activity. So a lot of different family members. So they learn the skills and they do it in a group environment. So they get that shared support.
I just wanted to let everybody know that this slide deck is hyperlinked in the agenda, and I also dropped the links to craft in the chat here as well.
Awesome, thanks. All right, next slide. Recovery support services, something near and dear to my heart. Recovery residences specifically, there's different types. We know there's chartered Oxford houses. Oxford houses are democratically run. People choosing to live in recovery themselves. There's no staff on site. They hold each other accountable. They've really grown in Colorado, and we've actually invested money to kind of pay for outreach workers to grow capacity. We also recognize that they were starting organically along the I-25 corridor, Denver, Colorado Springs, the metro areas. And so we really invested to say, let's open some on the Western Slope. Let's open some in Southern Colorado. Let's open some in Northeast Colorado. So now we've got good coverage. We've got places in Alamosa, plenty in Pueblo, Montrose, Grand Junction, a couple other Western Slope locations, and also in the Northeast Plains too. So we've made great strides there. And then of course there's the staff models. There are CAR certified. CAR is the Colorado Agency for Recovery Residences. They have a contract with BHA to provide certification for these facilities. Our MSOs, as well as some of the grants that we've issued, have been used by agencies to help open up CAR certified facilities. And so we've seen a lot of growth. Aaliyah did some good work. Let's show the next slide that kind of shows how we've expanded some access to recovery residences in Colorado. Go ahead to the next slide. And you can see, obviously lots of places where we don't, right? But the numbers in each of these counties represents how many either CAR certified or chartered Oxford houses are in each of those counties. We can see in our orange metro or our blue, that light blue Denver, large metro counties as we've defined them. We have lots of options in most of those. When we get into our micro counties, most of them have some. We have a couple that still do not. And our rural counties, it is much harder. And then when you get into our kind of critical access counties, that's what that CEAC means. There are a few exceptions, but there's lots of places where we have not yet reached that yet. And again, part of this is economy of scale of making sure that it could be sustained. An Oxford house needs to have, like 8 people in it to be able to pay the rent and keep the doors open and make it viable. Same thing for some of these CAR certifieds. They need to have enough. But my goal certainly would be to make sure absolutely that we have adequate capacity in all the micro counties, and start to work towards those rural counties as best we can, so that we have greater coverage. That southwest corner concerns me. I'd love to see even more growth up in the northeast corner as well. Obviously, there's lots of parts. I'd like to see some growth. I really thought we had something in Alamosa, but I might be wrong. So hopefully we'll either update the slide or we'll get something in Alamosa if we don't. So
It's been rumored, but nothing solidified yet. So I think they're working on it right
they're
now.
working on car certification then? Okay.
Yeah.
Very good. So we're getting there. All right. Let's go to the next slide. I know we got a couple more. So, and I'm sure I have outspent my time, so I apologize. So recovery support services for recovery community organizations. They offer peer support service, group meetings, social wellness activities, employment and education support, advocacy and community engagement, family and loved one support, and navigation of behavioral health systems. So we've had greater flexibility and funding on the substance use side. And so we've been able to work with our MSOs to contract with a number of recovery community organizations that are dedicated to providing recovery support services in rural areas. Some of them offer statewide services, again, remotely and virtually, but a lot of them have opened up locations to offer services in more rural locations. 10% of RCOs that provided information to BHA do operate statewide in some capacity, serving individuals across all regions of Colorado. So really recognizing that peer support is an extender of care, and often can be the type of support that a lot of people can use even if they're not engaged in formal clinical services. The benefit of being engaged with that peer support is those trained, hopefully certified peer mentors and peer recovery coaches also have the connections to the system, to other behavioral health supports, to knowing how to navigate the system, get enrolled in Medicaid, whatever it might be, so that if they are working with someone that they recognize needs more than they're able to offer, they have the knowledge and sophistication to try to connect them to a provider in their community that's going to be respectful of their recovery journey. So we really want to integrate our treatment world and our recovery world, not necessarily meaning integrating, they have to be in the same company. I think RCOs are really awesome to be independent, but being part of a collaborative, broader network of care, I think is the strength. We strengthen our ability to reach when we're able to, same thing with a provider, when they can recognize, look, I can only offer these things, but this person would really benefit from some of the supports at this recovery community organization. I think they'd be great. They need to work. Maybe they should go to the Phoenix to work out at a gym, whatever it might be. These recovery community organizations can do a huge benefit to supporting someone's recovery journey and expanding the reach of our system beyond just what clinical providers are able to do. All right, let's go to the next slide. And where do we go from here? Well, the biggest news, of course, is we have this new thing called BOSOs. I've heard it called, that acronym called many different things. I'm going with BOSOs for now. And these are behavioral health administrative service organizations. You've heard me mention ASOs. That's a regional entities we use to buy crisis services and Child Youth Mental Health Treatment Act. And MSOs, that's our regional entities we use to buy substance use services. Well, they all have different maps. That none of them align with Medicaid. Well, the ASOs align with Medicaid's map. Well, now we are working to buy mental health, substance use, crisis services, the full continuum, and recovery support services, the full continuum of services through our regional BOSOs. We have a new map that aligns with Medicaid's new RAY map, so they're the same. So there'll be a one-to-one connection between our BOSO organization and Medicaid's RAY, so that they can partner very closely as clients come in and off, as well as recognizing that Medicaid doesn't pay for things that we pay for, like recovery housing, right? So Medicaid could pay for someone's clinical support, but if someone also needs recovery housing, we have funding that can support people to stay in one of those CAR certified or chartered Oxford houses if they can't support it for themselves. So we're really hoping that this system is going to really strengthen continuity of care, a real focused regional approach to building our system, of care more effectively. And you can see Rocky Mountain Health Plans is going to manage that big blue section. I can't just call it Western Slope since they have a big chunk of Southern Colorado now too. And then Signal was awarded the contract for regions 2, 3, and 4. Experience in many of these regions historically from their, as they have been an ASO and an MSO. So they've got good relationships. Both the RAY contracts for Medicaid and the BASO contracts for BHA, they will be live on July 1. So they are working now with us and also working with community providers to do enrollment so that those providers that are currently contracting with either BHA or with RAYs, with MSOs or with ASOs, are all able to engage. And also, there's an opportunity to, just as we've seen with the MSOs, to expand their networks to include smaller providers where there are gaps in the system, and recovery support providers, small organizations. I think, we have a greater opportunity to see where we need to build capacity where it's lacking in rural and frontier areas, either with existing providers that are able to reach into those new areas, or with local providers in those communities that already have connections that might want to be part of the safety net system. And I think I'm done. And I'm probably over my time, but if there's questions, I can field them, or Caitlin, you just shut my mic off and tell me to go away. That's fine.
Nope, go ahead and go. So I know that Dennis's hand was raised first, back a couple of slides ago, so we'll go ahead and jump to Dennis.
Okay. In regards to the iMatter program, I did a podcast with Senator Mickelson Janae, who created the program. Caitlin has sent that out to everyone, and if you haven't watched it, please do. She goes into considerable depth on how it got started, why she pushed for it, and the fact she is now pushing for a national program of iMatter. And she let me know that the state of New York is about to pass legislation similar to what we're doing here. As advocates, this is something we should be pushing to anybody and everybody because of the children's mental health issues. And this, the 6 visits that you can have with this program are crucial in identifying problems early and getting help for kids. So anyhow, please watch that interview and inform yourself about the iMatter program and let people know in your network all about it. Thank you.
Dennis, thank you so much for underlining that. I think it's great, and Colorado is so lucky to have such a champion like Senator Mickelson Janae to lead this effort, not just here in Colorado, to even help advance it in other parts of the country. So thank you, and I will work to make sure that we get the annual report. Caitlin, I'll work and make sure you get that so you can share it out with people. Okay, thanks. So Kelly, next.
You're on mute.
I'm so sorry. I just jumped in because I know we're short on time.
Yeah, go ahead.
There was a question that had been kind of asked in the chat about providers and admin folk knowing about LTSS and CDAS buy-in services. Do any of those providers know about that supports, how to access that supports, how to direct those kinds of things? Because where I live, nobody knows, not even child welfare.
It's a great question. I know Frank is on the call from CBHC, and he could probably let us know the degree to which some of those those programs that you're talking about are familiar with our big comprehensive safety net providers. They're part of his association, and if not, how we might be able to get that out. BHA can certainly support in getting that information out, but we would probably work with like the Providers Association and CBHC to support us in that effort.
Well, the main reason that I asked that question is because when we're talking about like case management, peer supports, mentorship, those kinds of things, if we're talking about that, then this is an avenue that could be providing additional resources and supports. And if they don't know about it, then it's not being talked about.
Okay, so let's make sure we BHA have the information you're talking about, and then we can work on a strategy to make sure that we get that information out to our provider networks. Okay. Thank you, Kelly. And Megan, I love that idea that we do provider convenings. We have one coming up in a couple of weeks. We do them every 2 months, but that may be a topic that we could present at a provider convening. So I am absolutely open if we can identify who might be the best presenter for that. We're happy to kind of use that avenue and that reach to provider communities to bring that training to them. So thank you for that suggestion.
Of course, I'm dropping my email in the chat. CCDC does those trainings.
Beautiful connection and support there. Are there any other questions for Mark? Thank you, Mark. What an amazing presentation. That was a lot of information to cover, and I really appreciate your time and support in helping us kind of get this big picture and what's happening on the rurally and through BHA. Really helpful. Is there any other questions we have for Mark?
Thanks, everyone. Good to see you, Hope. It's been a while.
Great to see you too. Thank you. And thank you for being such a champion for recovery support services and behavioral health services in Colorado. Appreciate you very much.
Thanks.
Thank you. So we just have a few minutes left in our meeting. I think we're going to have to do some other update, like what's going on. We've got some other kind of push to March, the presentation from Megan and Tom we're going to do today, and maybe some more in-depth what's going on in our different sections, like departments, areas, specialties. But we'll do like a real quick, if we can. I know we got to get to public comment in 3 minutes. So is there like do you think we could do like a any high level, real fast prevention updates? Treatment? I know this is kind of like stressful and pushing. Dennis?
Before we run out of time, I just want to talk a little bit about the community engagement piece and the podcasts that we're putting together. Margie did a wonderful job on the Colorado Federation of Families for Children's Mental Health, and her board are putting together a system of care presentation that we will be doing. That, by the way, Senator Mickelson-Janae is very interested in as another champion for the services for children's mental health. I just posted a wonderful interview with Chow, thanks to Elia, who had me on an email chain, and I got introduced to them. And this is kind of interesting because Chow is a culinary, hospitality, outreach, wellness. And what it is it's a peer organization for people in the food service industry, employees, and the type of challenges they have. And we all use their services, and we aren't necessarily aware of what they're going through. But it's a great example of how effective peer-to-peer counseling can be. Caitlin has that link, and I'm sure she'll be sending that out shortly. And again, we've got the clubhouse that's going to be doing this. Senator Mickelson-Janae has agreed to do another interview next month with me. She really likes what I'm doing and how we can kind of collaborate with some of the other legislators to be able to get information to their constituents on mental health, behavioral health in general. Andrea has agreed to sit. for an interview once the friends and families intake form is further down the line to explain how that works. And I encourage any and all of you to jump on board with the behavioral health best practices to help feature what you're doing so we can get information out to the public. And again, be able to share this information with your networks. That's what Margie and I discussed putting together as advocates, something that can be a useful tool for everyone. But you guys have this opportunity to feature what you're doing and be able to get that out to the public. So, and hopefully Alia and I will get together and we're going to do an involved. Okay, I'm going to shut up now. Thanks.
Dennis, thank you so much. Appreciate you and all your work in your podcast and getting the word out about behavioral health in Colorado. You are a champion. We so appreciate all the work that you're doing. And we need to turn it over to provide space for public comment at this time. Thanks, Bonnie.
Oh, this is Margie. I know there's no time, but if there's any legislative updates that maybe we could be sent out about, I think that would be really helpful because I know there's always a lot going on and being on top of that is so important. Thank you.
Margie actually just let Hope and Megan know that I'm going to be sending out a couple of aspects about legislative updates in my follow-up email. So just keep an eye on your email. That is coming, I promise.
And we know Andrea Jones was on this call. I'm not sure if she still is, but I know she's always happy to chat with folks one-on-one if you have specific questions. She makes herself very available. So I think that's a great human that can answer lots of questions for you, Margie.
Beautiful share. Thank you. And I know that we're running out of time also on the recovery side of things. I'm sure most of you are aware or saw the Colorado Public Radio, the CPR articles that came out. I guess that's now been at the end of 2024, concerning some members of the recovery community. And it was, there were several, an investigative piece, several articles that came out that were pretty damaging and stigmatizing against the work that we do. And I think right now, as I've met Aaliyah Andrews hosts a recovery community organization monthly meeting. We just got into talking about it before we ran out of time, but as a recovery community coming together and uniting as a united force and front to, it sounds like we need to not only educate new legislators, but also and re-educate kind of just our legislative body here in Colorado on, the work that we do, that it is an evidence-based practice when held to fidelity, that we create incredibly positive and successful outcomes, and we are interwoven in our behavioral health system, and we are here and we do good work, and we as a team with treatment and providers, this is behavioral health, right? This is the BHA and who we are and what we are here to do. And so just uniting us together. I thank Megan for a really awesome idea of maybe we do like a support from our community in Colorado and doing like little 30-minute video vignettes of speaking of how recovery has supported you, what through recovery support, how your life has been improved, how you are in recovery. We each do like a little 30-second vignette. We send it to our legislators. So I loved this idea, Megan, and I think I can work with the other recovery communities, organizations here in this council, and Aaliyah, we can in our meeting to kind of maybe we can formalize this in a better sense. So we're hearing from our state. We know our importance. We know we change lives. We know we have really successful and positive outcomes, and we're changing lives. So just wanted to acknowledge that that's happened, that we are uniting and coming together as a united front to support the work that we do and re-educate that we are capable and wonderful and professional. And so just wanted to touch on that. We've got 1 minute left. I know we can didn't get through legislation. We're reaching that treatment. We didn't have an opportunity for you or prevention really. So we'll circle back in our March meeting and reconnect. And just please, as we mentioned earlier today, stay well. We need you. We can't help and do the work we do if we're not taking care of our own selves. So just thank everybody here for all that you do and staying well and who you are. Thank you. This is a wonderful meeting. We covered a lot. Thank you, Mark. It is time. So a meeting adjourned for our February BHAC meeting. Thank you so much, everybody. We'll see you next month. Take good care.
Thank you.
Thanks, everybody. Thank you so much. Have a great rest of
Caitlin,
your week.
Caitlin, this is Laureen. I will email you.
Perfect. Sounds good. Yes. I
And then-
reforwarded that email to you. So just check your email and make sure you got it, but definitely send me an email as well.
Yeah, that way I can look, see if I can find it first. Thanks a lot.
Perfect. Thanks so much. Have a good
Okay,
rest of your
take
week,
care.
Maureen. Bye-bye.